If you would, go ahead and place your name and campus in the chat. Check your screen name and make sure that it's correct. Again, we don't want any questions about whether or not we were here. So check all of that. We'll give you a minute or so to get that done. Hopefully everyone is doing well this evening. As always, these sessions are recorded and they are viewed by the attendance administrator. So just make sure you're on camera when you're supposed to be. In the event that you have to walk away, we usually take our break at the end. So, but you can take, if you need to step away to the restroom, just put a message in the chat, send it out to me. Don't send it out to everyone. And if you're having to step away for any other reason, just make sure you put it in the chat to me so that we can have a record of what's actually going on. So welcome to week 7. Hopefully everyone is doing well. We know that we've been having, I don't know if you all have, but in our area, we've been having these weather events. So hopefully everybody's doing okay. And hopefully the weather will, hold off tonight. They're saying that they're not tornadoes, but it leaves things as though that a tornado has come through, but they just said because the atmosphere is just so hot. And so we've been having these kind of like violent thunderstorms is what they're kind of describing them as, not a tornado, but not just your standard thunderstorm. But nevertheless, we're going to press on. We are in week 7, you all. You're almost there. So first, we're going to just spend a little time just thinking about and discussing it. I just want you to think about how you can adjust yourself, encourage yourself, refocus yourself, all that is needed. That's part of the journey. Even though we have these plans and goals, sometimes we have to, add some things so that we can meet those, those goals. We may have to delete some things. Yes, sometimes deleting things allows us to meet those goals. So I do want you in the chat to share out at least one study tip, one tip that you just know that has been your go-to that has brought you this far so that you're successful. Because you all are doing really well. Don't make light of that. You are putting the work in, you're spending the time, you have deleted things you need to delete, you put things on pause that you need to put on pause. You've looked at your schedules, you've looked at them and looked at them again and just met all of your requirements. You're doing really well. So I do want to encourage you to keep moving forward. Yes, it is a lot. It is a lot, but you're capable. And so identify those things that have been working for you. And as we share out in the chat, one thing that has helped you, it could be a study tip or whatever it is, a time management thing that you come across, send it out so everyone can see it. And as you look at others, what they're putting in there, it might be something that you want to add to your toolkit or try out. It might be something that you say, oh, I tried that. It didn't work for me. That's fine. So we're going to give you about a minute just to share out that one thing. At least, and I know it's several, but just share one thing that has helped you all thus far. Like I said, you are doing really well. So I'm just going to pause and let you think about that and send it out to everybody. Let me turn my little clock on here. 1 minute. Okay. Like I said, everyone just kind of check out what your team members are putting in, your coworkers are putting in the chat, Kahoot study guides, flashcards. Yes, we come across it a lot. Even if you're not trying to remember things, that repetition, however you encounter it, you automatically start remembering things. So yes. And so I know you wonder like why we're just repeating the same thing over and over again, because we do know that repetitiveness of it in different formats, it does help you to understand and gain that foundational knowledge. Now, Cahoots, yeah, most people, and we we can't use one that I like, but we cannot use, for the record, we cannot use Quizlet. The reason I like Quizlet, I didn't use what was already there. I would go in and just create my own. But it was one that, and I don't know if another resource is out there, but you could, it depending on your learning style. And also, not even if you were really not focused on your learning style, it just allowed you to look at the material in different formats. Like you would populate all of your information there, and then you could click flashcards, you could click puzzle, fill in the blank, and it would just take that information that you put in. And but nevertheless, that repetitive of it, can it get around not reviewing the content and study guides in short sessions. Short sessions is a key thing, you all. So, and I mentioned to you all, go back and look at our recordings. I mentioned chunk it up. I wouldn't advise sitting down looking at the entire recording in one setting, but if that works for you, that's fine. But yes, those short little snippets of it, even if you decide to meet in your study sessions or tutoring sessions, chunk it up. Make sure that it is like little short sections. And then go back and talk to yourself, and or you can record yourself and listen and play it back and see if what you're saying actually matches what your notes are saying, matches what your book is saying. And that way you can check out, oh, this, I have it wrong, or you're spot on and you have it correct. Great, great, great. Kahoot, study guides. Okay. Okay. Thank you, Alexis, for letting us know that. Okay. All right, good. So check it out. Like I said, at this point, we're life learners. We signed up for it. So we're always trying to fine tune, our practice, our craft and everything. So just be open to trying out new things. Sometimes it doesn't work and you go back to whatever you've already found out that works, and that's fine. So week 7, we're more than halfway there. Week 12, we just meet shortly to meet attendance, and we talk about some stats and make sure that you complete your survey. Week 11 are your HESIs. Remember, week 11, more than likely it's going to look a little bit different for you than it has been all term. I make note of this each time so you can just be thinking about and being proactive in reference to your schedules. You all work, you have families, you have responsibilities. So be thinking about what week 11 is going to look like for you. For sure, by the end of 9, going into 10, your campus deans, remember, HESIs are campus specific. They will be reaching out and letting you know when and where. More than likely, HESIs are not this HESI will not be this time of night. It might be, we don't know. Usually it is not. On your campus, your HESI for this class might be on a Monday. It might be on a Friday. And so just make sure that you are communicating when they send that information out to you, when it's posted. Make sure that you're looking for your campus and making those adjustments in your schedule if you need to. For the most part, you all are taking more than one class. And yes, all of those HESIs are generally given in that same week. So just make those adjustments so that you can continue to prepare and be ready. And so we do know we have week 10. We will hear from you all. And then week 9 is, I'm pulling up our classroom here. I'm just doing it off of memory. And then we have week 9 is our last exam. Let's make sure. I already have posted some information, like some study guides and all that, and we'll actually pull that up tonight too. So we are here, week 7. We are together tonight. Then we meet again next week. So content this week and next week's 2 weeks of content, and then that 9th week is when you take that unit exam 3. Okay, and then so that's our little pathway. We're almost there, you all. So continue to build upon what you're doing. Seek out new things if you think you need to, and look at those schedules. Make sure that if you're having to make up clinicals, if you're having to, whatever it is, some campuses are having Kaplans, whatever it is that you're having to do, find out what it is that you're supposed to be doing and make sure that you're adjusting yourself so that you can capture and get all of those things checked off your list. All right. So let's transition here. So I wanted to just give you like a little short little snippet here. We have Nurse Mike and Nurse Beverly. And of course, they're out in the community. So this is just a little short activity. And so I am going to actually put it in your Canvas mail. The first part is talking about data gathering and data generation. So what we'll do is, let me put it over here in your mail, in your Canvas mail. And what we're going to do is divide up into small groups for about 7 minutes, talk about it, and then we're going to come back and share out. Let's see here. I'm putting it in your Canvas. I will go back and look at the blueprint. Someone said something, it looks like the wrong document we uploaded. We'll check it out and we will correct it if it needs to be corrected. So if you're not in your Canvas, please log into your Canvas so you can see this little short activity that we're going to do here. And I'm sending it out to you. In the event that I lose connectivity or you lose connectivity, just log back in. If I lose, just, stay right there. I'll try to log back in. Just kind of throw that out there because, like I said, the weather is doing all different types of things, and that connectivity, you never know what it will do. So what are you getting ready to do? We're going to go to the breakout room. We have nurse, I think it's Beverly and Mike. They're talking, and they are discussing, they have just, they're community health nurses. So our community health workers, they're out there in the community. And so we're going to build upon their discussion. So they're discussing right now data generation and data gathering. So I am going to open the breakout rooms. So what you do is we'll spend 7 minutes. You all talk about it. When you come back, we're going to actually share out. So just remember that, make sure that you're on camera in the event that you need to log out of class because you have something else that, needs to be taken care of. Make sure you just log out and do that. Make sure that, remember all those prohibited places. We want you to be safe and the people around you as well. Okay, so accept the invitation to go to the breakout room. Look at your Canvas mail, discuss it, and we'll bring you back in 7 minutes. And the breakout rooms, and make sure no one's in the room by themselves. Let's see here. And it looks like we have it as evenly as possible. And they're open. Go to the breakout rooms. Let me set my timer. Look at your Canvas mail. It just says activity. And you're going to share out when you get back. Okay, everyone should be back in the main room in about 45 seconds. And we will hear from each group. So get ready, get ready, get ready.
Scooch over.
Okay, I think we have everyone back. So let's get ready. We're going to hear from everyone. And if you notice, in the chat, we ended up with 6 groups. Let me take one of these numbers out this wheel. Yes, we ended up with just 6. Let me take that out. Okay. All right. So we have, trying to find the little message here. Went off my screen. We have Nurse Mike and Nurse Beverly. So of course, our setting is the community. So they are getting ready to conduct a community assessment. So all things community. So with that being said, is there like just one person that they need to speak to? Is there one main place that they will need to look at to get this information? Because remember, so the patient here is the community. So just think about when we are, doing our AdPi, when we are assessing our patients. We ask all these detailed questions, we gather information, we observe information. So it's essentially the same, but the patient is our community. So with that being said, it says it is expected that the nurse will perform data gathering and data generation. It says nurse Mike, hold on. Nurse Mike asks, what are some examples of data generation and data gathering? And we were supposed to get together and discuss what is that? What is data gathering and what is data generation? Because they are different. Or are they the same? And then our next thing was when teaching a family how to prepare a kit for disaster, the nurse should instruct the family to do what? And that's discussed in list three things. So from the first question, let me spin this wheel here because we do want to ensure, and for the most part, you all will be pretty much paraphrasing almost the same, but you're going to say it differently because we're all different. But of course, we're going to be talking about the same thing. So, but we do want to hear from everyone because if you notice in the chat when I asked you about, that one main thing that helps you, have a good strong foundational knowledge of the information, a lot of you all put things that you do that are repetitive. The flashcards, you're continuing to look at that flashcard, front and back. The Kahoots, you keep on clicking on it and just keep going through it. So, hence, we will hear from each group. So I'm going to spin the wheel here, and then I'll just tell you who it will be. Our little wheel is spinning. And so first, data generation and data gathering it's saying group number 2, and that's Alexis and Carla. So let's hear from you.
So like the data gathering, I would say like the health department maybe.
Okay.
Like going back and reading like previous like census and reviewing like vital statistic records.
Okay. So why is that important? Looking at the numbers, vital statistics, that shows us what? The number of people that are supposed to be in that community. Or like you said, going back and look at previous record, it shows who was there, who's currently there. Why is that important?
To keep track of like who is like born in the area and who's passed away.
Okay. So that helps you too, because remember, we're gathering this information because, so to speak, the community is our patient. We're creating this care plan, this individualized care plan for the community. So we need to know as much as we can about this community. Hey, who lived here, who's currently living here, the ages, because when we decide on the interventions, we want them to be appropriate, right? We don't want to just be pulling things out of the air, just saying, oh, okay, we're going to do this for this community. And it's not what the community needs. It's not what they want. It's not their preferences. It is not what they need. So yes, that's a great point. All right. Did you all want to share anything else?
No.
Okay, let me spin the wheel. Here we go. Okay, it's saying group number 6, and that was Amy and Ashlyn. Data gathering, data generation. What you have for that first statement?
Data gathering could include like reviewing school records for vaccination record or vaccination rates or like absences.
Okay. So how does that help with creating a care plan for this community?
Like with the vaccinations, it would identify students that were more at risk for certain illnesses.
Okay. So again, you're able to tailor specifically interventions that are unique for this community. So in the event that there is a high vaccination rate in that community, we're less likely to have whatever, that that disease process. We're least likely to have. So our focus could be on something else. But on the flip side, if that community has a low rate of vaccinations, then our interventions would be more specifically about being proactive so that whatever disease process doesn't happen in that community. So again, we are tailoring those interventions specifically for who's in that community. We know who live there, we know how many, we know their age, and we're going to tailor it to the age group, children, older adults, and we're going to tailor whatever it is that we are actually telling them. Okay, great, great, great. All right, let's spin the wheel. So again, community assessment, data gathering, data generation. Think about the nursing process. The community is our patient. Okay, and it says group number 1. Okay, Ms. Hogan, Ms. Strand, and Ms. Sanders. Hogan, Strand, and Sanders.
So for the data gathering, we would look at like agency records, like from the local hospitals or clinics or nonprofit clinics to see who is utilizing the hospital in place of like a primary health doctor, to try and determine insurance needs or better care. And then like data generation, like we would do like the windshield survey, just kind of going through the neighborhoods and observing the spaces and what hazards and such and how people interact.
Ooh, you all are spot on. You're where we're going. That windshield survey. Yes. So yes, use that terminology that you know, and that's how you're generating that data. It's like you actually get into the trenches. You're out there, you're having conversations with the people, you're visiting the places that they live, that they work, that they exercise, that they play, and all of those things. And that's that windshield survey. And we'll talk more about that. And so that's real data that we're actually gathering. That's that assessment data, subjective and objective at its best. Great. Anything else that the others wanted to add from that group? That was it? Okay. All right, let me spin the wheel here. 3 more groups left. Then we'll move to our second little part. Okay, group number 4, which is Miss Blue, Miss Hunt.
Well, when they making the disaster kits after you figure out like who was in the group that you gotta make them for, you need to know like what type of supplies as far as like different sizes you would need. Because if you got kids, they're not gonna need the same size like the adults. So you would be getting the information like their ages, the diagnosis. Because if they have like if you was trying to do math, you need something that fit. Like you can't get a N95 that don't fit. It's not being any good.
Okay. Anyone else from that group? So
That was
specific. Go ahead. I'm sorry. Go ahead.
Oh no, I was saying that was it.
That was it. Okay. So yes, going back to what the first group initially said, finding out who's there. Is this community highly populated of adolescents, older adults, or is it a nice mix of everybody? And so with that being said, when we are thinking about resources, and I think it was the previous group also said it about the pay status, and it may be you all as well, like if they have insurance or not. So in the event that we're in this community and we're trying to provide the best care we can, we see that there is a high rate of those that do have insurances. So more than likely, our attention would not be spent on raising funds to offset or identifying resources to offset that cost. Because healthcare, it is a cost to healthcare. The person may not directly pay for it, but someone pays for it. And so on the reverse side, if it's a community where there is low rates of insurances, then we will need to be identifying resources that can make donations and or nonprofits that do provide specific funds so that those community members can still receive the health care that they actually need. So good, finding out about that community. Good. All right, we have 2 more groups here. We'll hear from you, then we're gonna move on. 3 or either 5. Which one is it going to be? Let's see. Number 5. And so that is Candace, Jamela, and Yelena. Let's hear from you.
Some of the things we came up with were some from the other groups I've already mentioned, like reviewing census data, looking at local disease and mortality rates, getting reports from public health departments, studying community health surveys, examining hospital or clinic records, reviewing vaccination rates.
Okay. Anyone else in that group? All right, hearing none. Thank you all so much for sharing. Okay, so the next thing, it says, when teaching a family how to prepare a kit for disaster, the nurse should instruct the family too. So what were some things that you told them that they need to be in the kit? And then the why, because you do want to give them the explanation of, well, hey, you need this because of, and you need this amount of this. So what were those things? And you all, let me just hear from 3 different people. What did you all say?
Necessary medications and first aid supplies.
Okay.
Like be ready for 72 hours, like water, food, stuff like medication, ID.
ID, that's a thing we don't really think about. It's in the purse, it's in the bag, it's somewhere. We don't really even have our IDs on us most of the time. But yes, great. What else, you all? What are we telling them to put in that kit?
I would say
like cell phone, flashlight, batteries, first aid kit.
Food and water.
Okay.
Yeah,
blankets, maybe a jacket or something if it's cold, and like with the babies and stuff, maybe have that extra diaper bag full of their stuff real quick and easy to go, already ready.
Okay.
And I will also tell them like a radio and like hygiene products.
Okay. Good deal.
Just like
do we as nurses here, do we have our disaster kits ready? You all, look, I fixed the disaster kit and then we're gonna use the stuff at the kit. That's not a good thing, is it? But really, with the weather things the events that we're experiencing, we really do need to put that there, a dedicated space, and leave it there. So anyone else that just have a kit and this is something we just need to include in there, just off, from based on your experience. Any other items?
I've always taught my my daughters, like when it's stormy and we're expecting really like other possible tornadoes, whatever, to have a pair of hard sole shoes close to the bed. So if you have to jump up, you can throw them on, because if there's a disaster and you're going to be out walking around, you need to protect your feet.
Yeah, exactly.
I know this one sounds a little harsh, but also, things to protect yourself as far as in like safety, guns and things like that, because people, in emergency situations go a little bit crazy, I think.
Okay. Good deal. All right. So I'm going to recap what we just said, and then we're going to move on to the next part of Nurse Beverly and Nurse Mike's discussion here. Let's see. Slideshow. So what is this thing called community? We're talking about the community, gathering information. We want the community to be prepared. So what is this thing called community? If you would have to define that, what is it? Group of people, a place. What is this community doing? And so forth and so forth. So community refers to the dimensions of the place, the people, the persons, and the function. And so when we are measuring the dimensions of the people, the community health nurse will access data sources from the census data, the tourist bureau, civic groups and churches. All of that information is important, gathering all of that information, because whether one of these sources might have the data looked at in one way, another source may have us to look at it in a different view. So the dimensions of the community, the people or persons that live there, and then that function. So library, police stations, welfare agencies, state departments would be data sources to measure the function's dimension. And then the dimensions of the place will be measured with data sources such as maps, newspapers, and local housing offices. This thing called community. So community partnerships, they focus on active participation by the community leaders, businesses, and organizations to develop programs with the healthcare professionals. So Nurse Beverly and Nurse Mike, they're out there they're doing this windshield survey, and they're trying to gather all this information because they're going to identify the need for this community. They're not just coming to this community with preset interventions, but they're specifically creating this unique care plan. So like the example we said about the insurance, we may need to identify more resources to help offset that pay. We might have to identify more resources for the adolescents or the elderly, because there are some communities, you all, that are like age specific. You find more of one age that lives in that community. So that's why it's so important to gather that information. So these programs have a larger goal of collaboration. You got to collaborate, partner to achieve the outcome, which is providing this for the community members. So a business that provides low-cost snacks to an after-school program, these are the partnerships, and these are the things that actually happen. So another example is, well, this is pretty much a passive partnership. So a city creating a new park, a hospital providing vaccination clinics, a recreational center offering cooking classes as a passive partnership. The other example that I was going to give was there is a local nursery that is partnering with some of the major hubs in the community, and what they're supplying are the plants. So the whole thing is so that the community can have fresh fruits and vegetables. So they're not only producing these, but they're giving the community members the opportunities to have their own raised gardens and beds on the front porch, the back porch, or even in the home, And so that is a passive partnership. Another example, we talked about this the other day, was where the health departments, they have all these different programs. And one of them is with a registered dietitian and this nurse. What they do is their focus is nutrition. And so they meet is all things nutrition, but they make it specific for like the individualized chronic disease processes. So not only do they bring the community people to the meetings, they also make it individualized based on this person has diabetes. So this session is going to be more focused on carb counting. And so not only providing that education, they also have the making takes. They actually do the cooking classes there. Because a lot of times we want to try out a recipe or something. Really not sure about that because it may not taste how we want it pleasing. So this gives the individuals opportunities to try it out and decide, well, hey, this is something I can eat. And then never in addition to that, it's something that's going to be healthy for me. So you translate from the nursery providing the plants, the raised gardens, the beds, to the fresh fruits and vegetables, taking it to the kitchen. And then we have the people providing the cooking classes. And so the community it's a work of heart, is thinking outside the box. You're using your autonomy hat, and the possibilities are just unlimited when you're talking about working inside the community, being that community health nurse. But it's going to take that gathering that information, like we said, from the census tract and all of that, and seeing who are we serving, who are we trying to serve. So allow community members to participate in program evaluation, collaborate with community leaders to design interventions. So we want to bring, the people in, because remember, same things in the hospital. The patient has to agree to the interventions that we're trying to implement, right? Because it's them that's receiving the care. So it is the community that will be receiving these resources and interventions that we are trying to implement. So let's bring them in. Let's see what let's send out an evaluation. It can be in person, it can be via text message. Will we see, hey, what do you need? What is important to you? And then once we actually finish implementing the program or some way through the program, we come back and evaluate, hey, do you think this is working? Or are there any things that we actually need to actually change? Okay. So data generation is a process of identifying data that does not exist, but it's developed through interactions with the community. Like, who was that? Was that you, Corey, that mentioned the windshield survey? So that's getting out in the community, having the conversations, looking, visiting the places that the people actually live and work and play. So it's not really those things that you learn from visiting those places. They're really not written in a book anywhere, but you do generate that data. So examples of data generation include information about the community values, their beliefs, and their social norms. So having those conversations, they'll tell you, hey, you know, if you're gonna have an event, don't have it on a Wednesday, because on Wednesdays we're at the ballpark. The grandmas are there, the moms and dads are there, everybody's at the ballpark. So if you want to have an event, you probably need to have it on any other day but Wednesday. And so they'll tell you that. They'll say, for example, Sundays, that's a day that we tend to not to do anything. People choose to worship, or even if they don't, we tend to not have events and things on those days, because why is that important? We don't want to be hosting an event when everybody's at the ballpark and no one's at our event, right? So having those conversations and interactions, doing that windshield survey helps us to generate information, gather information about the community. Remember, the community is the patient. So data gathering is that process of collecting information that exists, such as age of residents, racial distribution, and health organizations. Any questions so far about that? So we mentioned that windshield survey. It's a method to collect data about the community by observing the community through riding a car, getting out walking, riding, if they have public transportation. You are really in the trenches. You eat at the places that they're eating at. You go to the places that they work. You visit the places where they live, and you're gathering information. To conduct the windshield survey, the nurse would need to understand the community boundaries to ensure that the community is accurately observed. So we need to know, are there any boundaries here? For example, we did a community event on, was it yesterday or Tuesday? And so the person that actually organized it, they tried to collaborate and organize it so that it like dominoed effect. So the people were there to play and have fun. These were older adults. They were playing cards. They were playing bingo. They had all these activities going on. So the organizers say, hey, this ends at, we'll just say noon. And so what was being organized was a wellness screening. When the wellness screening, you got the opportunity to get your blood pressure checked. You got a chance to get your cholesterol checked. If you're a diabetic, pre-diabetic, you got your A1C. From there, you went and talked to the doctor. From there, you went and talked to a navigator that helped you with your next steps in the event that things were identified. And those next steps could have been, hey, you need to attend a gym or add more physical activity in your diet. I mean, physical activity in your daily plan. And so not only did they tell them that, they identified places that they can actually go, identify programs that they can actually sign up for. And so had that organizer not known those things about that community, that event would have kind of more than likely been not successful, because what if we would have had that event the same time that the bingo and the dominoes and the Uno games were going on? Who do you think? What event you think they were going to go to? You all, they were going to come to the wellness, or they were going to go and have fun and play bingo on those things? More than likely, probably go do the bingo and the cards. So we would have had this resource, this whole beautiful program, but it would not have been taken advantage of. So that's why, in addition to that, that's why it's so important to know, to do this windshield survey, to find out what it is, observe, know the population size, know what that social economic status is. So, like I mentioned, if it was identified that the person needed to add more physical activity, in their daily regime, then they had a paid gym. Then they had a program where the person could get 2 to 3 months free of charge for committing to going to that gym 2 to 3 days a week. So, in the event that, you say, hey, add physical exercise in your regimen, daily regimen. But then if I don't have the funds to pay for that, and then my neighborhood is not where I can walk or get out and get that exercise, what am I going to do? I'm going to not get the exercise. But had we not done the windshield survey and generated that data and found out through those interactions, then our event would have just been a bomb. It would just been an event that we had with low attendance. Okay, so the population size and social economic qualities and governmental structures would be observed also during this survey. So pretty much not leaving any stone unturned. So you have communications or interactions with places of faith, if they have businesses there, the government agencies, pretty much everyone. So a windshield survey is a structured observational method used in community health nursing and public health to quickly assess everything, physical, social, environmental characteristics of that neighborhood. It is typically conducted by, like we said, driving, walking, but nevertheless being interactive within that community, looking and seeing for real what is going on in this community. What resources are already there. So we talked about disasters. You all named some things. So disasters are labeled as natural or man-made. Natural disasters are events that occur naturally, such as earthquakes, communicable disease epidemics, droughts, and hurricanes. So it seems like we were in a drought when we first started off, and with temperatures being 110, it's like we're headed more toward that. So that leads to what crops and things not growing like they're supposed to. And eventually farmers have to, count their crops as being a loss. Those are natural disasters. Man-made disasters are events that are directly human created, such as pollution, warfare, fires, water supply contamination. And it seems like, was it about 2 years ago? It seems like every other day, or at least every other week, we were hearing about trains actually derailing. And those trains, were the ones that were derailed, seems like they had like these chemicals and waste products on there. And so that's a man-made disaster. And also, just checking the chat. Also, we would need to think about, hey, if this train has derailed and it has this cart has chemical waste on it, and there's a lake or there's a community where there's a school, we need to be proactive and think about how can we prevent the community, the children, the people that's drinking this water from being contaminated. So we need to identify those sources pretty quickly and get those things controlled. So we talked about things being in the kit. So flashlight, batteries, battery operated radio, those things are kind of hard to find this day and time. Extra pair of eyeglasses, if you wear those, even if you wear contacts, having those glasses or those extra contacts available. A 3-day supply, because and then 1 gallon per client per day. So a gallon for each person per day. So, and then have enough so that you have a 3-day supply. So in the event that you have to go to the shelter or whatever, at least you can sustain for those 3 days. And usually by then you should see a help coming. And then because sometimes it depends on the area and what has actually happened, there's a delay with help actually coming there because they can't get through or the conditions are so dangerous. So similarly, a 3-day supply of also non-perishable food. Like I said, we've had this kit and it seems like we end up, let's go get those. We need those batteries. or let me get those snacks out of there. So we got to replenish and really put it up, especially with everything that's going on with the environment. Now, I'm not really sure. It just seems like maybe we've always had this kind of weather, but it just seems like we're having more and more extreme weather events. All right, so let's move on to our next activity. So from all of that, and I like to add in some information, I just give it to you. But of course, want to address all learning styles, but I think if we can make it more lifelike or more interactive, to me, it seems like you can remember it better or understand it best, and also identify what you have questions about. Because remember, next gen is the way to go. So not only knowing the information, you have to be able to apply it to some situation. All right, so let's get ready to look at our other little tidbit of information here. Let's see here. We still have Nurse Mike and Nurse Beverly. So they have went into the community, they have done their assessment. Now something has happened. Please put this in your box as well. So got a little scenario. And then we're going to respond and share out for that as well. You might need about, we gave you 7 for that. You might need about 10 minutes for this one. This is just a little bit more. And this will be our last one, and we'll move on with the rest of our content. So any questions about the content that we went over, any of the scenarios and things that we gave? Are we good on that? Everybody good? Are there questions? If they are, please ask. Then, of course, in the subject bar, I'm just going to put activity. I won't give it away, but something has happened. So they're having to respond. And it says message sent. So again, we're going to go to the breakout rooms. It's going to randomly, Zoom just randomly puts you in a room with someone. And so the task at hand is looking at your Canvas mail, sent you another email that says activity. I want you to read through the scenario, talk through it, and then we'll share back out. And rooms are open. Accept the invitation, and we'll see you in, let's maybe do 9 minutes. You all have a good understanding of the content. It might not take this long. Okay. And start. Okay, everyone should be back in about 40 seconds. Everybody's coming on back in. Yeah, but 4 more that's trying to get back in. 9 seconds, everyone should be back. Okay. All righty, so we have Basil County experienced a series of severe storms. And so we have essentially a disaster. This is one of those natural disasters. A tornado happened, homes were damaged, roadways were impacted, there were power outages, and there is not that much access to clean water and refrigeration. Because why is refrigeration, is that an important thing to think about during this time? Or is that not an important point? Refrigeration of our foods, is that important?
It's very important to prevent contamination and bacterial growth, safe foods.
Got it. So, because typically, how do we unthaw our frozen food? Do we put them on the sink or we put them in the refrigerator to
Should be in the
unthaw?
refrigerator.
Okay. All right. So expired foods, should we hold on to those or should they be discarded?
Discarded.
Okay. What about washing of our hands? Is that important or do we need to be washing our hands?
It's very important.
Got it. What about if someone is cutting up some meat and they have to also cut up vegetables? Are there any precautions or anything that should be considered?
Wash your hands in between. Don't cut the meat and go straight to the vegetables. You should wash your hands.
Okay. What about the things that we're using to cut them up? Do we need to do anything with that?
Get a different one or wash them.
They need washed.
Okay.
Definitely don't cut the meat and then cut the vegetables.
Got it. Good. All right. And so, refrigeration is not there. There's a lost access to clean water. So Nurse Mike and Nurse Beverly, newly assigned to the community health team, are deployed to assist with assessment and coordination. I already talked about data generation and data gathering. So they pretty much know something about the community as already. So, and they said that the infrastructure, power lines are down, water contamination is suspected. And then our population, when someone said, look at the census, they already gathered that information. They know that there are older adults, low income families there, and that there are a individual with chronic illnesses that actually live there as well. Because they did the windshield survey, because they got out and walked and interacted with the people, they know that the local church serves as the shelter. The clinic that is there, they don't have a hospital, but they do have a clinic, but it is operating. It's operated on that generator power. So being disaster prepared, if you can, add one of those in the little kit. So food insecurity, loss of refrigeration, stores are closed, and so Nurse Mike and Nurse Beverly, what were the three things that you all listed? Do want to hear from you in regarding what would be the nurse's role in this situation? What did you all name? And need to hear from each group. And I'll just let you all just go.
One of the nurses' roles in that situation would be assessing what the clinic has available. If they're just on generating power, trying to figure out how we can get like resources in the National Guard, someone to come in that can help with any kind of medical emergencies that pop up.
Okay, great. Thank you. Keep it going.
Providing health education, about contaminated water, like we talked about, the food safety.
Okay, great.
And to avoid downed power lines and things, let people know to avoid that.
Okay. That was 3 groups. Keep going. There were at least 6 of you all, 6 different groups.
I would say,
oh, sorry.
oh,
I
you're
also
okay.
have that the nurses can assess injuries, health needs, provide emergency care, can help assist with gathering supplies, and identify the vulnerable people that need immediate assistance.
Okay. Keep it going. It's good so far. You all are rocking.
I would probably try to make contact with like the Red Cross and FEMA to try to come in and help with the shelter and actually help with the medical needs and shelter for the residents, so that gets them into homes in a safe area, and maybe even get the law enforcement involved for like when you have a big disaster like that, a lot of loitering goes around, and that would be a safety for the people in the community.
Okay. And so the Red Cross, so there is a representative for each area. So you would have to identify the representative in that area. And so that was a good point. and also getting the law enforcement involved. They may have to post up and say, hey, don't go this way. Someone mentioned the down power lines. Because if you're just out there just, trying to get through or trying to get somewhere to a place of safety, you may not realize that there's a live wire and it's down in that area. So yes, getting everybody, all those resources that we know that's already there because we've done that community assessment, that windshield survey, we generated that data. So coordinating all of that. Wow. Nurse Mike and Nurse Beverly, they're doing a great job. So I think I haven't heard from one group. Keep going. Did I hear from all the groups? Okay. It's an honor system. All right. So the next thing was each disaster phase has a distinct purpose. What did you all come up with? How many phases did you come up with and what were that?
Preparedness. Like the community prepares before disaster occurs, like including emergency plans, disaster drills, emergency supply kits, evacuation plans, and educating residents.
Okay. Anyone
And
else?
then we also came up with mitigation, which is actions taken to reduce the effects of future disasters.
And then there's the response, which is during and immediately after, which focuses on like the immediate needs and saving lives.
Okay. Great. Let's see here. Over here. The way program planning begins with the needs assessment to identify the problem, population needs, and available resources. These are all things you all have just said. So, but without that accurate assessment and data collection, interventions might not meet what's really need to be done met at that time. So, yes, getting that information, like looking, seeing, do we have down power lines? Is there still access to running water? And therefore it kind of curtail and is specific to what's really going on. So when a federal emergency has been declared, the National Response Framework may provide specific needs to the community. The role of this NRF is to support the community experiencing the disaster with transportation, because think about it. There may be a tree down on the vehicle. The person can't even start the car up to actually go from one place to the other. A lot of times housing is affected. So they provide that support in having that temporary housing. A lot of times if there are large facilities like schools, I know like in one area that we serve, when there was a tornado that came through, they turned the gymnasium, because it's like a gigantic, beautiful building, and they turned it into a shelter. And so they provided that temporary housing. There were some hotels and things are available. They also used the transportation to transport people to the neighboring town so that they could stay there. But nevertheless, temporary housing. Medical resources. I just found out the other week that there is this, and I was supposed to go back and look it up. This nonprofit out there, and what they do is during disasters, we say put that in the disaster kit. But like I also said, we go into the disaster kit and get those things out of there. But medical resources is a big thing that people need, and they need to have access to it. So that nonprofit, the spokesperson said they pretty much just kind of follow the news, and they go to the people and seek out what they need. So if they've heard that there's a disaster in Florida or a disaster is in Texas or whatever, they pretty much, because think about it, people really can't reach out to them. So they go to wherever they've heard there's a disaster, but their focus is medical resources. That includes medications. They said they work with, didn't someone say identification? They said they work with the doctor's offices and pharmacies to ensure, even if they have to, and they say it's a whole process to it. Even if they can't get it from that town, they'll get the medications and the resources for someone else. But they actually coordinate all of that. And so, of course, you would need your identification to prove who you are and things like that. And so the NRF provides assistance with search and rescue and also firefighting. Need to know.
Also, just coming from like the fire industry, there's NIMS will get activated if there's a disaster, which is the National Incident Management System. And they're also the ones that will coordinate with FEMA.
Okay, great. So know that these things are available. Because those are going to be the things that's going to help, going to be essentially your hands and feet and your eyes to help put all this stuff together to make it happen. Knowing that these resources even exist. Okay, so Nurse Mike and Nurse Beth, they're doing all these things. So which level of prevention? Remember, I told you levels of prevention is heavy. So which level of prevention would they actually be exercising? The disaster has happened, and they're notifying NIMS, they're notifying the coordinating transportation, housing. What level of prevention is that? What you all say?
Is it tertiary?
Tertiary.
And y'all got it right. Y'all are rocking. Yes, because something has happened. Good, good. So each disaster phase has a distinct purpose. You all said preparedness, and this focuses on planning and drills. Responses prioritize immediate triage, life-saving care, and then recovery restores the community. I may need to use a different background. I was trying to be fancy. Recovery restores community function and provides long-term support. So you have the preparedness, the response, and the recovery. Yep, that's tertiary. You all got it. So you kind of need to know about this right here. What is this MSDS? Because there's been a disaster and we may be coming in contact with, food that's not being refrigerated. And we said that, food should be unthawed in the refrigerator. We want to wash our hands. We want to make sure that we're not using the same utensils that cut up raw meat as vegetables. But what about the MSDS? What does it tell us about? Not food, but what?
Chemicals that we could come in contact with.
Got it. Chemicals. I thought I had that written out here, but yes. So the MSDS, and you all pretty much are familiar with these. That's that book that sits on your nurse at your nursing station or back there in that room. But nevertheless, in the event that we need to know something about that chemical, a chemical that's being used in that facility, this is where you find is a quick reference, and they must have that in these facilities. So the MSDS. Not MDS, not minimum data assessment, but MSDS is a material safety data sheet. It tells you everything you need to know about the chemical. So we were talking about teaching our families and ourselves to get these disaster kits ready. When teaching a family how to prepare a kit for disaster, the nurse should instruct the family to stock enough food, we said, for 3 days. Then we need to have them to go back and check. This says every 6 months. Sometimes we probably need to check maybe a little bit more often, but know that when we put those items in there, go ahead and look at the shelf life, the expiration date, and therefore at a minimum, make sure that they're going back checking and seeing every 6 months to see if those things are still good. Because if we have all these things stocked away, then if they're all expired, they're not doing us any good. And so I think that's why they keep emptying out my disaster kits. Like, hey, this stuff is getting ready to be out of date. And so we just use it. So we want to ensure all members know where the kit is. And then the other piece of it is turn off those utilities. How many of us know how to go and turn off those things? Where are they even located at around the house or in the yard? And then, like we said, reviewing supplies every 6 months. This verifies that those items are not expired. And then in the event that we need them, that, we can still, they're good for us. We already talked about, if meat and things are unthawed, because sometimes if in the event that there's a disaster and there's no electricity, then that stuff is going to unthaw. It's not going to unthaw properly. You don't want to just be, eating meat and things that have been just left out. We want to make sure we're washing our hands, using separate things to cut those vegetables up. All right. So any questions about this disaster planning? You all are rocking with this. Any questions or concerns about it? We're pushing our break to the end, so just bear with it. We're almost there. We only have about 10 more minutes. Any questions? Okay, so hearing none, I did want to go ahead and just start looking at your, what did you all tell me, the blueprint for the exam was wrong, or the blueprint for week 7? What did you all tell me we need to go back and look at? Which one was it? Was it you all that told me to go back and look at a document we had uploaded? It wasn't you all? Okay, so I'm waiting on my little document to pull up here. It's spinning, it's spinning. So while we're waiting on this thing to open up here, you all, just some housekeeping tips. Just make sure that in the event that you're thinking about exam 3 being proctored, if you know that, you need to be reaching out early on, because will need your campus dean approval, the faculty person. They have to find a place and all of that for you. So go ahead and be proactive with that. And so they have to have that 72-hour notice. And also, I'm not sure why this not pulling up. Wow. Because they want to have a place and everything prepared for you. So if that's something you're thinking about, go ahead and pre-plan for that. And then make sure that for all of your courses that you're going back to week 1, looking at everything. Because remember, you have NCLEX, you have, once you get out in your clinical settings, whatever setting you decide to go work in, you never know how your day-to-day is going to be. But if you have that strong foundational knowledge, you're going to be able to provide that best care, even if it means, hey, reaching out and saying, hey, I need help or assistance with this. You ought to keep spinning. So just give me just a moment. Okay. So what is the science concerned with the use of resources? And I'm looking at your study guide, your note-taking guide, not a study guide. So what was that, the science concerned with the use of resources, including the production, distribution, and consumption of goods and services? What do we call that? Begins with the E. What you all said was? Economics. So do social economic status, does it affect mortality and morbidity?
Yeah.
Exactly, it does. So Medicaid is based on age, or is it based on income?
Medicaid is based on income.
Got it. Low income or no income. Okay. So we do know that technology is now defined as the application of science to develop solutions, health problems or issues, such as prevention or delay of onset of diseases, or promotion and monitoring of good health. Okay. So now let's trend to violence, and we're gonna just kind of start with this one because we don't have enough time. We're gonna run out of time. But we'll finish it and pick it up next week. So community violence refers to the violence that occurs between strangers, friends, or acquaintances. So it typically takes place outside of where a person actually lives. Okay, so it does include physical fighting and assault with or without the use of firearms. So intimate partner violence, it includes physical, sexual, all of the above. It also includes stalking. And it could be the intimate partner could be someone that is current or even former, or even the person's spouse. And so sexual violence refers to sexual activity when consent has not been obtained. All right. So what did you all find or define the answer for what it says is an umbrella? And I'm looking at this note-taking guide. What did you all say for is an umbrella term that includes activities involved in recruiting, harboring, transporting, or providing an individual for forced service or commercial acts? What is that called?
Is that trafficking?
Human trafficking, exactly. So red flags for human trafficking, family members or friend who doesn't allow the individual to answer. You're doing your head to toe assessment, you're asking these questions, and the person that's in the room with them that's supposed to be their friend or their family member does not let them answer the questions. This individual may appear to be reluctant, hesitant in describing symptoms or events that led up to, the complaint. And they may not have any identification. And so they may even be unaware of actually where they are. So asking those orientation questions, where you are, all those things, these things are important because in the event that you have someone that's alert oriented, seems to be orientized for it, and they don't know where they are, then that could be not 100%, but indication. More than likely, this person is not in a place that they normally are. Could be a flag that they have been they're being humanly trafficked. Physical signs include bruises, burns, laceration, bite marks, vaginal tearing, STDs, unintended pregnancy. And so suicide, which changing subjects here, suicide is the second leading cause of death in persons between the ages of 10 and 24. So we've found out that development of abuse patterns often comes from people that have seen abuse before, and they think that that's the norm. Okay, so indicators of child abuse. So we are mandated reporters. Nurses need to recognize the physical and behavior indicators of abuse and neglect. So what are some indicators, you all? Just come off mute and just name a few of abuse and neglect in a child. What are some things that we might see?
Bruises in different stages of healing,
Mm-hmm.
unkempt, dirty
Okay.
clothes.
Mm-hmm. What about their bones?
To be fragile.
So they may end up with like broken arms, fingers, and things like that. It's like, why do you keep having, what keeps going on that you're, falling down, breaking things? But it could be in fact that person is actually, causing harm to them so much so the impact is actually breaking their bones. Okay. Elder abuse is an intentional act or failure to act that causes the risk of harm to an older adult. An older adult is considered to be, 60 or older. For Medicare, we say 65 and older. But a person is considered an older adult. Really the children say we're old if we're going on 30, but for real, they do say we consider it as an older adult if once we turn the age of 60. All right, so we have not taken our break, so this is the time that we'll take our break. And so we will see you all on next week. Be sure to review this recording, look back at your notes, and we're going to build upon and get ready for exam 3 in HISI next week. You all take care. I'll stick around if you have questions or concerns. See you next week.
Thank you.
You're welcome.
Thank you.
You're welcome.
Thank you.
You are welcome. Take care.